So hey guys, what's up? So welcome to World News 20 News channel. So let's talk about COVID's vitamin D link. What data from 20 countries show a new study has found an association between low average levels of vitamin D and high numbers of COVID-19 cases and mortality rates across 20 European countries. The research, led by scientists from UK's Angelina Ruskin University and Queen Elizabeth Hospital, King's Lynn NHS Foundation Trust, is published in the journal Aging Clinical and Experimental Research. Vitamin D is known to modulate the response of white blood cells, preventing them from releasing too many inflammatory cytokines, part of the body's immune response to fight infections. And the SARS-CoV-2 virus is known to cause an excess of pro-inflammatory cytokines called a cytokine storm. The new study shows that Italy and Spain, both of which have experienced high COVID-19 mortality rates, have lower average vitamin D levels than most northern European countries. This is because the researchers said it's partly because people in the southern Europe, particularly the elderly, avoid strong sun, while skin pigmentation also reduces natural vitamin D synthesis. The highest average levels of the vitamin D and found in northern Europe due to the consumption of the cod liver oil and vitamin D supplements and possibly less sun avoidance. Scandinavian nations are among the countries with the lowest number of the COVID-19 cases and mortality rates per head of the population in Europe. Euro said in a statement on the new research, "We found a significant correlation between the average vitamin D levels and the number of COVID-19 cases, and particularly COVID-19 mortality rates per head of the population across the 20 European countries," Dr. Lee Smith of the ARU said in the statement. Vitamin D has been shown to protect against acute respiratory infections, and older adults, the group most deficient in vitamin D, are also the ones most seriously affected by the COVID-19. A previous study found that the 75% of the people in institutions such as hospitals and care homes were severely deficient in vitamin D. We suggest it would be advisable to perform dedicated studies looking at the vitamin D levels in the COVID-19 patients with different degrees of the disease severity, Dr. Lee said. So if you like the channel, so kindly subscribe to it.